day and welcome to your COVID-19 update for today, July 12, 2022. I'm here today with Dr. Frank Anthony, Minister of Health. Dr. Anthony, thank you for joining us. Let's begin with the number of current active cases.
Well, over the last 24 hours, we've recorded 184 new cases, and we have about 826 active cases across Guyana.
Okay. And could you give us a breakdown of these cases by region?
So in Region 1, we currently have 42 cases, Region 2, 48 cases, Region 3, 79 cases, Region 4, 434 cases, Region 5, 32 cases, Region 6, 60 cases, Region 7, 52 cases, Regions 8, we don't have a case there, but that's because they haven't done much testing. Regions 9, 30 cases, and Regions 10, 49 cases.
Dr. Anthony, we continue to see a spike in COVID-19 cases in many countries. Can this be a cause for newer variants circulating in Guyana?
So right now, the new wave that we're seeing globally, that's because it's driven primarily by a new subvariant of the Omicron, and that's the BA4 and BA5 subvariant. This subvariant is more infectious than previous subvariants, so it's more infectious than the BA1 or BA2 or BA3. And even if you were infected with BA2 before, or BA1 or BA3, you can get reinfected by this newer variant. So some people probably who've gotten infected with COVID before, if you're not careful, if you're not wearing your mask, you can get reinfected with the current variant that is now circulating. And that's the Omicron BA4 and BA5. So people just need to be careful. Now, one of the reasons why we're seeing an increase in infections is that the BA5 and BA4, they're more contagious in a sense. So if you don't wear a mask and you're in a crowded area and you have persons who maybe have been infected, that virus can easily transmit from the infected person to persons who are at risk or exposed. If you wear a mask, it prevents that infection from occurring, especially if it's an N95 mask. The other thing that you need to know is that with the current variants that are circulating, if you've had your primary doses, and that was more than 6 months ago, then your vaccination status is not going to be very effective at protecting you. So you really need to get your booster shots. And if you had a booster more than 6 months ago, then you need to get a second shot. Now, what this is going to do is to help to prime your immune system and prevent you from getting a more severe form of the infection if you get infected. So we have a number of persons who are currently in hospital, 36 persons who are currently in hospital. We have 5 persons in the ICU. The challenge is that these persons, if they are vaccinated, they haven't gotten their booster shots. And in some cases, we are still finding people, after almost 2 years of giving vaccines, we're still finding people who are not vaccinated.
Okay, Dr. Anthony, in the past we've spoken about building our capacity in terms of gene sequencing locally. Can you give us an update on that, please?
So at the National Public Health Reference Lab, we do have a gene sequencer. We have trained our staff at one of the best labs in the world, that's at Harvard, and they are back. They have done sequencing on the Plasmodium falciparum parasite, and we are now working to see how they can sequence COVID virus. So that's something that we're still working on. It would require having different material and so to do that. but it's something that is on our agenda, and hopefully before the year ends, we'll be able to do that type of sequencing here in Guyana.